Vince Markovchick, Professor Emeritus of Emergency Medicine at the University of Colorado, and I'm based at Denver Health as an emergency physician. I never thought of myself as a writer. I never majored in anything in college that would prepare me to write, but I had the opportunity fairly early in my career to write a few chapters and participate in the writing of some papers, and that piqued my interest and said, you know, I could probably do this. And then I had a wonderful opportunity to become the first editor of Emergency Medicine Secrets, and that's where I really was able to hone my skills in writing and editing. Well, we asked each chapter author to give us 2 secrets from their topic area, and then the editors get together, and then with Emergency Medicine Secrets, that was probably 210, I think there's 105 chapters, 210 secrets that we got from the authors, and then we had to try and narrow it down to 100, and was difficult, but we did it. It's evolved in content and in breadth. In other words, the first edition didn't have as many chapters, and as emergency medicine evolved, we ended up adding chapters. For instance, ultrasound, some of the pre-hospital disaster medicine, weapons of mass destruction issues after 9/11, toxicology. That field has expanded, so we added some in that area, and so and as emergency medicine research, of course, expanded. Pre-hospital care, resuscitation, those areas, we expanded those chapters, and I think selected authors who were experts in those areas to write the chapters. So it's an evolving thing. It really does change from one edition to the other, and now we're into the 5th edition. I think they're going to use it as a very quick reference. They don't have the time to sit down and spend an hour and a half plowing through, you know, a very comprehensive chapter on a given topic. I think they want to go in and get the highlights of a given area, in this instance emergency medicine, and then the areas within emergency medicine. I mean, if we have a medical student rotating through the trauma side of the ED, pretty easy for them to read the trauma section in Emergency Medicine Secrets and have a reasonable understanding of how we approach things, how we approach patients, how we think in emergency medicine, because it's different than in many other specialties. To communicate information that I think is important. I think having 35 years of experience in emergency medicine, I think you get a perspective of what is important and what maybe isn't so important, and also to give young authors, young emergency physicians, the opportunity to write. This is not a difficult these are not difficult chapters to write compared to a standard textbook. And so it's a nice opportunity for bright young emergency physicians to have the opportunity to author some chapters. Well, we're always interested in receiving your input onto how the book could be improved in future editions. In particular, we'd like to know what you'd like to see in future editions.